Okay, so here is an x-ray for review. Notice that this little marker up here which says L on it is referring to the side of the patient. Remember that the right side of the screen is always the left side of the patient and vice versa. So the first thing that I like to do is I like to do A first. A is the trachea. I like to look for the trachea. As you can see, it comes down in this area right here. Okay, and then notice that it branches this way, and if you can make it out, you can see it branches this way and down like this. Now, looking at the trachea is important because you can tell if it's being shifted in one direction or the other. If it's being shifted in one direction or the other, that could mean the presence of a pleural effusion or atelectasis, pulling or pushing the trachea in one direction or the other. The other thing too is if the patient is intubated, I can see if the endotracheal tube is in that trachea as well, and we typically want that between 3 to 5 centimeters away from the carina, which is right there. So one example of this, for instance, if we had a lot of fluid on this side, either inside or outside the lung. Let's say we had whiting out on one side of the lung. The question is that a pleural effusion or is that a complete atelectasis of the right lung? And the way you'd be able to tell is if this was a pleural effusion pushes, and so the trachea would be deviated to the opposite side. However, if it was atelectasis is a collapse of the lung. It would pull it towards the right side of the patient or the left side of the screen. The next thing I like to look at is B, or bone. So I like to look at and compare the bony structures, paying very close attention to site, size, shape, shadows, and borders. You've got the clavicles right here. Okay, so you can look for any kind of fractures. You'll notice here there's like a cacophony of ribs going by. The ones that are very horizontal are the posterior aspect of the ribs, and then you'll see ones in the front that are coming down. These are the anterior portions, and you can see if those are fractured or not. This one right up here at the top, you can see here right above, the clavicle is related to the first rib. You see the second ribs here as well. You can also look at the spinous processes and see if they're lined up all the way down, and you can look along the edge and see if there's any compression fractures. So these regular intervals will be disturbed if there's any compression fractures, so you can look at those as well. The other thing you can look at is for lytic lesions in the bone. I don't see any here. This is a normal x-ray, but sometimes you can find lytic lesions, and these look like basically holes in the bone. They're lytic lesions, so they have air density inside of bone density. Sometimes you can find some extra cervical ribs, which are a little bit off of this, but you wouldn't be able to see that here. So that's B for bone. So we've covered A and B. Join us for the next video where we talk about cardiac, which is C.